in-depth report by the Detroit News, produced through the New York and Michigan Solutions Journalism Collaborative, is bringing attention to the high number of maternal deaths across the country, including right here in Michigan. The data is especially concerning for women of color. According to the state, Black mothers are more than 75% more likely than white mothers to die during pregnancy, while giving birth, or within a year after the pregnancy ends. Here's my conversation with Dawn Shanafelt, who is director of the Maternal and Infant Health Division in the Michigan Department of Health and Human Services. Dawn, welcome to American Black Journal.
Thank you so much for having me.
Yeah. So, I want to start with us talking about why this problem exists. We live in the most developed nation on earth, an extremely wealthy nation, and yet you have these numbers that show that having a child is dangerous and dangerous to a lot of people. As I see it, it's an access problem and it's an investment problem. I'm curious about your take on why the wealthiest nation on the planet is struggling with this.
So you're absolutely correct regarding your assessment that it's an access and investment problem. I also think that access needs to be coupled with the highest quality care and respectful care. Simply having access to prenatal, postpartum care, and ongoing medical and social support isn't enough. It needs to be, as I said, the highest quality, respectful, and align with what pregnant and postpartum families tell us that they need. In addition, I think the lack of investment or addressing the challenge up until the recent years really speaks volumes to the population that's impacted the most, right? We're speaking of women, and Black and brown women.
Yeah.
So that is indicative of the challenges that our country faces as a result of how it was created and built.
Yeah. One of the interesting things from this report is also the number of women who die in the first year after delivering a baby. And that's something that I'm not sure a lot of people know about or understand. Can you talk about why that happens and how that's related to prenatal deaths?
So the period following pregnancy or immediately thereafter, the postpartum period, is a critical time. And it's often coined the fourth trimester. And that's because so many potential things could happen during that time as a person's body gears up to be pregnant. It takes time for that process to unwind, right? And as a society, our focus at the time of delivery immediately shifts to the infant, which is extremely important, right? The infant's health and well-being is important, but that shifts away from the person who just had a baby.
Yeah.
And so we know that first 42 days following pregnancy and even up to a year after, there's a critical time of potential complication and really, to frame it positively, a time when support is needed.
Yeah.
This is an important time of transition where we need to be wrapping our arms around the entire dyad and family unit.
Yeah. Of course, the numbers here are horrible universally, but as you point out, they're even worse when you're talking about Black and brown women. That's maybe not surprising given the inequalities that exist elsewhere in our society, but talk about how, the difference here is just so stark and so dramatic. There almost seems as if there's something else driving it, not just the standard inequality.
So I think it's multifactorial in that the root causes are systemic racism, the intersectionality that I mentioned, the lack of focus and support, and then really ultimately not respecting and listening to patients. We hear time and time again where Black women tell us they knew something was wrong.
Yeah.
Something didn't seem right, and their expert knowledge, right? They're within themselves. That's expert knowledge. That assessment is disregarded. And I think that we need to also think about the fact that the poor outcomes are perpetuated before and after entry into the hospital or healthcare setting for delivery. And it isn't a one-time occurrence. It's an ongoing buildup of interactions that result in poor outcomes. And then in addition to that, I believe that it's really necessary to, again, listen and respond accordingly, and then also focus on accountability and understanding that the patient is in the driver's seat, or if it's outside of the healthcare setting, right, for a home birth or in a freestanding birth center. But the individual who's delivering a child should be at the forefront, and oftentimes that isn't the case. And then the last comment I'll make regarding this is the fact that the systems that were built are exclusionary.
Yes,
they were not built to be inclusive to Black and brown women, and Black and brown people, and I think that needs to be. We really need to center families and acknowledge that, and not only history, but the current reality.
Yeah. So one of the kind of frustrating things about this is that, of course, we know how to turn these numbers in a different direction. We know what people need, and we know how to do it. And there are all kinds of success stories from programs that I've read about and seen where just the effort, just putting in the effort to make sure someone has access to healthcare during this time, it changes the numbers, appreciably. So I want to talk about what you think solutions look like. Is it just a matter of committing to doing what we need, what we know needs to be done?
I think that it's more than simply committing. I think that there's multiple levels of acknowledgement that need to happen. And along with that acknowledgement, it goes further. You need action to align with that. And so the solutions lie within the people that we serve. I'm obviously a public health person, a nurse, bureaucrat. If we listen to the people that we serve, the solutions are there. Families will tell us exactly what is needed, exactly where the barriers are, what challenges need to be removed, and we need to be responsive. And I think that systems level change needs to happen. Often there's been a focus on more of a medical model, focusing on people, as if there's a personal challenge, right, that needs to be addressed. A pregnant person needs to change themselves, when in reality, they're immersed in the systems of challenge. But then also, I don't want to be completely negative. Focus on the positive, right? The birth is a beautiful time for families. And I think that hope and that right that people should be afforded needs to be the ultimate focus. So as far as solutions, there have been multiple solutions implemented that are creating amazing change. The Michigan Doula Initiative. So valuing, honoring, raising up the doula profession that's been around for hundreds of years and has proven effective. Things such as centering pregnancy. When you bring people together during the prenatal and postpartum period in a sense of community, that support, that human relationship should never be underestimated. And programs such as centering put the patient in the driver's seat.
Yeah.
They're leading their care. And in addition to that, like I said, systems level change, policy change, understanding that fourth trimester is so important. And that's why extending postpartum coverage is important. The pregnancy may have ended, but that period continues. And imposing barriers such as lack of access to healthcare is something that we can remove.
Yeah.
So not only as we move forward, but removing those barriers. But I really think that acknowledging that the negative impact of the social drivers or social determinants of health are the result of systems that were created for them to be there.
Yeah.
So I think that we need to acknowledge that and move forward in revamping and rebooting and altering systems so that humankind is centered, which was really the heart of the solution.
Yeah. Well, Dawn Shanafelt, that's the time we have. I really appreciate you being here with us on American Black Journal.
Thank you so much. And I'm honored to have the time to talk with you.